Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
The number of vaping-related illnesses in the U.S. continues to rise, now reaching about 1,300 cases and at least 26 deaths. The outbreak appears to have started in March and now has a name, EVALI, a new name. Symptoms include severe shortness of breath, fatigue, and chest pain.
What do we know about it, and what might be the cause? And if you're vaping, should you stop? Joining us by telephone from the Mayo Clinic in Arizona is the Division Chair of Pulmonology and Critical Care, Dr. Karen Swanson. Welcome to our program, Dr. Swanson.
Thank you so much for having me.
Dr. Swanson, I want to ask you, it seems like people have been vaping for years, and all of a sudden people are getting sick, people are dying. What's changed?
Well, I think in this current, really, public health crisis that we're having, one thing that's changed is some of the vaping products related to THC, which is the psychoactive ingredient in marijuana. This is accounting for most of these cases of EVALI, which, as you mentioned, is the new name for vaping-associated lung injury, and that stands for e-cigarette or vaping product use-associated lung injury. So it's not just vaping, but it can also be e-cigarettes. The majority of these cases have been due to vaping THC, but not all. So we really don't understand the underlying pathology or bad ingredient that might be causing this lung injury at this point.
And are most of the people who are being diagnosed with EVALI teenagers?
So that's a really good question. We've had the opportunity recently to publish a pathology paper in the New England Journal of Medicine just a week or so ago. And this included 17 patients who actually had lung biopsies that were related to what clinically was felt to be EVALI. And the median age in that group was 35. And so in the published literature so far, many of these cases are in younger adults, much more unusual than what we saw in the past with smoking-related lung injury, for example. And we do know that teens are vaping. We do know that something like 20% of all high school students have tried vaping. So
Wow.
it is something that really is becoming a public health issue.
So you mentioned that the majority of people who have gotten sick or died were using tetrahydrocannabinol, THC, the active ingredient in marijuana. But there were, 13 or 15% of patients who died or got sick just vaped nicotine. So it doesn't all make sense, does it?
No, it doesn't. And we have to remember, really, what does vaping mean? And I think many people think that vaping, what is being exhaled in that plume of smoke that we see so commonly, is not water vapor. So in order for something to be aerosolized and inhaled, you've got some kind of product, and it's usually THC or nicotine, but then you need something to dilute that so that it creates a solution, and then you have the heating element, which is usually a heated coil powered by a battery that turns that solution into an aerosol that can then be inhaled. So even the coils might release underlying metals like manganese or zinc into that aerosol that can be toxic when inhaled. So we don't really know if this is coming from the heating elements. Is it coming from whatever solution is being put in there to turn the nicotine and THC into a solution to be aerosolized? For example, oils. There's all these flavorings now. So there's so many components to this that it's unlikely to be any one thing.
So it's got to be something pretty toxic if it can actually damage your lungs to the extent that you die.
So this is an excellent point, and this is the major public health message. And for teenagers to be talking to your friends and not being, not sucking on a vaping or an e-cigarette device that somebody from school hands you to suck on. In our pathology study, what we've found, looking at lung tissue from lung biopsies of vaping-associated lung injury, is this is a chemical or a caustic, almost burn of the airways and the lungs. So this is definitely inhalation of some sort of toxic product that is going into the lung. It is not water vapor. It is not something that is benign. This is something that our pathologists have equated it to mustard gas exposure like in World War I.
But you'd think it would hurt when you inhaled it.
Yeah, this is what we're seeing pathologically is really the airways don't have a lot of pain receptors in them. And so unlike thinking about a burn on your arm or your skin, for example, the airways and the lungs don't really have pain receptors. That's on the outer part of the lung or the outer lining of the lung.
Makes sense, I guess.
As the mother of 2 teenagers, I'm going to ask specifically about the new CDC guidelines that are for physicians, but also thus for parents. So what are they?
So the recommendations currently are to not vape any products or use e-cigarettes, especially for teenagers, pregnant women, young adults. And one of the reasons in teenagers that is so critical, and it's not just THC, but it's nicotine as well, is that we know that teenagers' brains do not develop until about the age of 25, and we know that even nicotine can harm parts of the brain that are related to attention, learning, mood, and impulse control. All huge issues in teenagers. And now with kind of the fruity and candy-like flavors and some of these devices looking really sleek and sexy, the teenagers need to know that this is harming not only your brain, but it's contributing to potential nicotine dependence and also potentially something that is life-threatening because you have no idea what is in these products.
And isn't there also some concern that this disease, EVALI, now can be confused with the flu? We've got the flu season coming up, and the symptoms early on can be similar.
Yes, and this is critical. I think it's going to be even more difficult as we go into the fall and early winter season. Patients with EVALI will present with underlying cough, maybe some mild to even severe shortness of breath that is progressive. They can have fevers. And importantly, what we're really starting to realize, they can actually have non-pulmonary symptoms, meaning they can actually have nausea, vomiting, diarrhea. You might even be thinking of some sort of underlying food poisoning or something like that. But when they come into the hospital or the emergency department and they have a chest x-ray, the chest x-ray might be normal or abnormal. If they have lower oxygen saturations, a CAT scan of the chest will almost certainly show underlying abnormalities caused by e-cigarette or vaping-related use.
So you've got to be on your toes to make sure that you don't miss this diagnosis because it is potentially treatable.
Yes, we need to rule out infection, especially things like influenza and pneumonia, and we need to make sure that we are getting an accurate history. Most providers are both physicians and advanced practitioners are very adept at asking about smoking use, less so about vaping use. So it is important to ask specifically about e-cigarette and vaping use because patients, if you just ask them about smoking, will say they don't smoke. So I think it is important that we start getting an accurate history and to include e-cigarette and vaping history, ruling out infection, and then if there is that vaping history, to really have a high clinical suspicion and really look into that a little further. Might even lead to a lung biopsy. We do know in some patients, if they develop very severe illness, the ones that end up in the intensive care unit and even on a ventilator and who potentially die, those patients end up with a very diffuse form of lung injury.
Is smoking e-cigarettes safer than smoking cigarettes?
So that's a really good question. E-cigarettes have really developed trying to help people get off of traditional cigarettes, which we know long-term have problems with chronic obstructive pulmonary disease, emphysema, as well as lung cancer. E-cigarettes are probably safer than traditional cigarettes, but they definitely are not safe, and they definitely still lead to nicotine dependence. And now with this EVALI situation, I would say that no e-cigarette or vaping device is safe at this point.
We've been talking with lung specialist Dr. Karen Swanson from the Mayo Clinic in Arizona. There is a vaping crisis in this country, at least 1,300 sickened and close to 30 deaths. The cause remains unknown, but vaping illness now has a new name as EVALI. If you're using e-cigarettes or if you're vaping, the best thing to do is to stop, especially if the product contains THC. Thanks for joining us, Dr. Swanson.
Thank you for having me.